Radial nerve is the largest branch of the plexus. It arises from the posterior cord and receives fibers from C5 to T1. It leaves the axilla posterior to the axillary artery and enters the arm where it lies in the radial groove in the posterior surface of the shaft of the humerus with a deep brachial artery between lateral and medial heads of triceps muscles. Radial nerve gives off posterior cutaneous nerve of arm in the axilla. This provides sensory sensation to the skin on the posterior and inferolateral arm. It also gives off posterior cutaneous nerve of forearm as it travels through the radial groove. This gives sensory innervation to the skin of posterior part of central forearm. Radial nerve pierces the intermuscular septum to enter the cubital fossa and forearm. In the distal arm, anterior to the lateral epicondyles of the humerus, radial nerve divides into two terminal branches, deep or muscular and superficial or cutaneous branches. The deep branch is muscular and articular and innervates the muscles of the posterior compartment of the arm and forearm, while the superficial branch is cutaneous, supplying the skin of the dorsum of the hand and fingers. Radial nerve is susceptible to injuries in many ways. Radial nerve may be injured during fracture of the humeral shaft affecting radial groove. Injury to radial nerve may also occur due to fracture to the distal end of the humerus, otherwise called supracondylar fracture. As a result of these injuries, there is paralysis of the extensors muscles of the wrists and fingers. This manifests as a clinical sign called wrist drop, where there is inability to extend the wrist and fingers at metacarpophalangeal. Joint and wrist is partly flexed due to unopposed action of the flexor muscles and the gravity. If this video is helpful, consider subscribing or clicking the like button.